Hello, my name is Ed Bottomley with the Michigan Medicine Department of Communication, and I'm going to be your host for today's chat on coronavirus. This week, the World Health Organization declared a pandemic as the spread of COVID-19, a disease caused by a novel coronavirus, continues around the globe. There are currently at least 110,000 confirmed cases worldwide, and more than 1,200 confirmed cases in the US. While the situation is actively changing, communities throughout the country are taking steps to help slow the spread of COVID and protect those who are most vulnerable. Today, we are joined by Dr. Sandro Cinti, Professor of Infectious Disease at Michigan Medicine.
Hello.
He will try and provide accurate facts and guidance for people who are undoubtedly worried about this unprecedented situation. So before we get to Dr. Cinti, we have a few housekeeping items. You can submit questions at any time, even now, for Dr. Cinti to answer during the Q&A portion of today's chat. Questions can be submitted in a number of ways. You can comment on this video, but please note that your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send us a private message, or you can email us at ask-mishmed@med.umich.edu. If you can't stay for the whole chat, or if you want to share this live chat with a friend, a video of the chat in its entirety will be available on the Michigan Medicine Facebook page, Twitter account, and the Michigan Medicine YouTube channel. So let's move on to our questions for you, Dr. Cinti.
Wait, first, little hand hygiene. We got to practice good methods here.
Indeed.
Okay.
So my first question for you, how would I distinguish symptoms of coronavirus from symptoms of the flu?
It would be very difficult at this point. Coronavirus and influenza have very similar symptom profiles, and so when we are seeing patients where there is a distinction that needs to be made, we're doing testing for the flu virus, which we have a lot of. Unfortunately, as we can talk about and questions may come up, we're not fully stocked with coronavirus testing yet, but they present very similarly with clinical syndromes, and that's cough, shortness of breath, fevers, night sweats, aches, muscle aches, sore throat sometimes. So it's very difficult as a clinician to say, oh, this person has coronavirus and this person has flu.
By way of an intro, could you describe what the coronavirus is?
Sure. It's a virus, and to let everybody know, we know coronaviruses. Coronaviruses have been around forever, so it's not new. Coronaviruses are typically very mild illnesses, and that's why we don't do very much with them, because in the community, people do very well. These are different. There's another coronavirus that many of you know about called Sars, which occurred in 2003. This coronavirus is not as the mortality rates aren't as high, but it's spreading a lot faster and a lot more wide spread than the first SARS. I've heard this described this way. SARS as a class is a class of coronaviruses. SARS-1, so SARS would be like the human race. SARS-1 would be Ed. SARS-2 would be me. So they're that close in terms of how their genetics. Now, in terms of where it came from, animal spread is typical. This is a virus that's common in bats. And there was probably a bat link at some point to both the SARS, the initial SARS, and the SARS, what we're calling SARS coronavirus 2. And remember that it's SARS coronavirus 2, the disease is called COVID-19. The disease is mild in most people. 80% of people are going to do fine. In 20% of people, they get more severe illness. And then there's a subset of those people who will get severe disease that puts them in the hospital. And those are people who are older, who have underlying medical illnesses such as hypertension, heart disease, lung disease, diabetes, and we really need to protect those people.
Thank you for that. The next question we have is about exposure.
Yeah.
How long does exposure to a person carrying coronavirus need to be before it's considered prolonged exposure? For example, is the time it takes to pay for a cup of coffee prolonged exposure?
I'd have to qualify that, because if there's somebody there are people who will have coronavirus who are initially asymptomatic and may remain with very few symptoms. And the question is, are you at risk from that type of person? So if you're standing in the coffee line with somebody who has no symptoms but has SARS in their mucosa or in their nose, if that person's not coughing, if that person's not sneezing, and you don't touch a surface that person touched, then your risk is zero of getting it. So the answer is, with asymptomatic carriage, if you're not going to get that. If somebody is coughing, of course, being in a line, yes, you could get exposed if somebody coughed. The distance is 6 feet is what we're propagating right now. That people who are sick, if you're sick, wear a mask. Protect. The mask doesn't help you if you're not sick. The mask out in the community does not help to prevent spread. What it helps is if somebody is sick and they're wearing that mask. So if you're not feeling well, it is appropriate to wear a mask, and we in the healthcare setting will make you wear a mask. So again, a little bit of a difficult question to answer, but it has to do with this person in front of you being symptomatic or not symptomatic.
Thank you. And then as a follow-up to that question, we have a question here. Do you need to go into isolation for just being exposed to someone with coronavirus?
The answer, and the difference between isolation is taking somebody who actually has a disease and putting them, and isolating them. Quarantine is taking somebody who we don't know who has the disease and putting them away from others. And the answer to that is, with a high exposure risk, if you know that somebody had COVID-19 and you were exposed to that person, particularly in the healthcare setting, we would have our healthcare workers not come to work in that setting, and to monitor themselves very carefully.
Thank you. And then as a follow-up to that question, if we're talking about self-isolation, how long do you need to be isolated for if you go into self-isolation?
And what the CDC and the World Health Organization, those two entities, and those are the places you should be looking for information. They're saying 14 days because that is the distance at which, after 14 days, you're not going to get sick, most likely. On average, it's about five days where people get symptoms.
Thank you for that. Now, how do I protect members of my household if I think I have been exposed to coronavirus?
So first of all, is you monitor for symptoms. As I was saying, somebody who's asymptomatic may carry the virus. So that is pretty clear. We know that from studies that have been done already. The question is, how effective are they at spreading that virus? So if you think you've been exposed, but you have no symptoms at all, then making sure you do hand washing, make sure that your family members do hand washing, minimize contact. I think it really is important to do that. Minimize the very close contact. Unfortunately, maybe you can't hug your family member for 14 days. You got to do the elbow bump like that. So I think those things are necessary, and then monitor yourself for 14 days. If you have symptoms, on the other hand, mask. Isolate yourself in a part of the house where you're not going to be exposed. Have people bring you food until you've recovered. What's getting pretty clear too is, with recovery, people are less likely to spread also. Once fever goes away, the spread is probably less. Fantastic.
Now, as a side note, for naming this, I've been saying coronavirus.
Yeah.
Perhaps we should, just for the public, so we're both on the same page, just call it this coronavirus, not some of the other technical names, just so lay people coming in on board.
Okay, we could call it COVID-19.
COVID-19, I like COVID-19. Let's do COVID-19.
That's the disease, remember, but that's what we're worried about, really.
Yeah, because I don't want to cause any confusion, that's for sure. So, the next question that we have, this is an audience question. I have an autoimmune disease. Should I go out into public places?
Again, that's a very difficult question, and one that is changing day by day, depending on how. In Michigan right now, there are not that many cases, maybe a dozen at this point, half a dozen. So I think when you're going out into public, if you are immune compromised, you are at high risk. I do think it makes sense to avoid big crowds. I think being very aware of the spaces around you, making sure that you wash your hands. It's very difficult to keep your hands from your face, as many of you know, but that's key, particularly because there are two ways this virus is spread. If somebody's ill and coughs, and you're within 6 feet of that person, and then fomite spread, which means on a surface. So that's why you want to wash your hands. If somebody touches a surface, you certainly could then get the virus afterwards. So washing hands, not touching your face. I've been trying to put my hands in my pocket when I walk so that I don't bring them up to my face. There are practical things you can do where you can then go out into the community, still be safe, but protect yourself. I think going into big areas where it's going to be very crowded, it's probably worth at this point trying to avoid that. And I think our public health folks are saying that. The governor is saying that. The fact that we're mitigating this by closing schools, by stopping certain events. Somebody says, we really know we're in trouble when the NBA isn't playing anymore. And I don't want to panic people because we need to do these things even though this virus, we're saying, is mostly people are going to do fine with it. And I think that's a point I'd like to make, is there's this high anxiety out there in the community. And it's because we're giving two messages. It's partly our fault. We're saying, oh, this virus isn't so bad. And then on the other hand, we're saying the NBA can't play, and you can't go to school, and you can't go to work. And so people, what's in between there? Why are these this can't be right. How can you say something's not so bad and we're shutting down basically communities in order to prevent it? And I'd like, if I could at this point, I'd like to put something up that one of our historians, Howard Markel, has put out, and we'll send this out to everybody also. Howard Markel is a historian, and he did work related to the pandemic flu of 1918, and that was a very bad flu. And certain cities handled it very well, and certain cities didn't. And he went back into records to kind of figure out what happened in that situation. And so I'm going to draw a graph here. And so down here is time. This is time going by over here. This is the number of people at any particular time who are sick. People who are sick and need care. This is 0, and the numbers go up this way and time goes forward that way. Now let's look here. This is our healthcare system's capability to take care of people, this dotted line. Our hospital and healthcare system, below this line, we're going to do really well, and we can take care of people. We'll do fine within the healthcare system. Above this line, we're above capacity. And we run pretty close to this line all the time. Now, let's imagine there are two cities, City A and City B. Here's COVID-19 disease, starts here, time 0. City A does nothing, says, we don't believe this is a problem. Let's just go as we're going. Let this ride itself out. Here's City A. Okay? City B. This is City A. City A does nothing. City B says, we got to get on top of this right away. We know that this virus doesn't kill most people. As a matter of fact, it kills very few. But we want to protect those people, so we're going to close the schools. We're going to stop all get-togethers greater than 100 people. We're going to get people to work remotely, which we could do now. We couldn't do that in 1918, but we can do it now. And this is what happens. This is City B. City B. City B closes schools. Sorry, I don't know if anybody can see this. Prevents get-togethers, crowding, work from home. I would ask you out there, which city do you want to live in? Which city do you want to live in? And I've asked young folks this, and some young folks, you know what they say? I think I'd rather live in City A because it's going to be over much more quickly. Then I asked them, where do you want your parent with hypertension to live, your grandmother with heart disease, or your cousin or brother with diabetes? You want them to live in City A and City B. Hard to argue that they would want them to be living in City B. This is what we're trying to do. We're trying to protect the most vulnerable people within our society, those people who are sick, those people who are going to get this and end up in the hospital and overwhelm our system. Below here, we do pretty well. Above here, there's going to be more mortality, more morbidity. People are going to get sicker. Here, we can maintain this. Our hospitals are doing a lot to get ready for the onslaught of extra patients. What they can't do, what a hospital can't do, is stop how many patients are going to come in. Mitigation can do that. So I think that's a point I want to make because it does explain both this idea of, well, the disease, we want to say the disease isn't as bad as you think, but yet we're doing all these very severe things.
Thank you. That's really a fantastic illustration of that. We're going to link in the comments section to the blog post we have about this, Howard Markel, about flattening the curve.
Yes. And again, when Howard Markel did this for 1918, the research that he did showed that the cities that were City A did very badly. Mortality rates were much higher. City B, much better.
Fantastic. Thank you for that. Now,
thank you, Howard.
Yes, indeed. So the question that we were on, and let's circle back to a similar question about autoimmune disease. The next question we have, what should post-transplant patients do to stay safe?
I think it's the exact same thing that I was talking about with anybody who's got immune suppression, and we see a lot of transplant patients. And transplant patients are very healthy overall these days because they're doing well. But you're on immunosuppressants, very definitely. And so the same thing, protecting yourself by not going into too crowded spaces. But when you do go out, be aware of your surroundings. Protect yourself by maintaining distance and washing your hands. Those are two things that we can't say enough of. You hear me, I'm not saying wear a mask. Mask is, one, the mask probably isn't going to protect you from somebody coughing around you. It won't protect you if you touch something and then touch your nose later. Furthermore, our healthcare workers really need these, and the people who are sick should be wearing the masks. So if you are not sick, the two things, which is hand washing and what we call social distancing.
Sure.
Social distancing doesn't necessarily mean you have to lock yourself in a room in your house, but it does mean you have to be a little careful when you go out. The second thing I would say is protect everybody else around you. Let's be good citizens. If we are sick, let's either not go out or wear a mask and maintain our distance from people.
Thank you for that. And we have a number of questions which are going to touch on that point. I think it's fine if you reiterate. People are logging in and logging off.
No, I will.
Yeah, excellent.
And I may even wash my hands again.
The next question that we have, should I keep appointments for massage or for personal training at the gym?
Let's take that situation. A one-on-one trainer, the gym can be a place where a lot of people touch things. It can be a place where things are, where maybe the hygiene is not as good as it would be in other places. But on the other hand, all these workout places, they have cleaning material. So if you can clean a surface, if your personal trainer, make sure your personal trainer is not sick. If your personal trainer is not sick and you can clean surfaces, I think that it is okay to do that at this point. We may be curtailing these. Clubs may close at some point, but at the moment, again, being careful, being aware of the surroundings, cleaning the surfaces, again, spread by somebody coughing, 6 feet distance, or by fomite spread from touching surfaces.
And then a follow-up question
Yeah.
to that, how about going out to eat? Is it okay to go out to eat?
And by fomite, I know people don't, we use the term fomite a lot. It's basically, fomite means the virus is on the surface and it's going from the surface when you touch it to your fingers. And this virus can live quite a while, not weeks, maybe days. We don't know how long it can stay on a surface and still be transmitted. But you have to be careful that way and assume that surfaces may be contaminated. I'm sorry, Ed, go ahead.
Oh, no, not at all. So is it okay to go out to eat? I imagine similar
I went out
answer.
last night. Yes, I think it is similar. Similarly, again, when you're going to be going, you'll be maintaining a good distance from most of the people. Your wait person will, maybe you don't shake hands with your wait person who you know at your local restaurant, and maybe you try and maintain a little more distance. The people behind you, around you, be aware. People shouldn't be going out. You don't go out when you're sick to protect others. So don't go out to eat when you're not feeling well. I think if those things are done, then yes, people can do those things. When you're getting into real crowded, so if you're going to go, eating out is different than clubbing or going to a place where you're going to be in a real tight place with other people who might be sick. That may be a little more risky. But I think going out in a scenario where you can maintain distance, that should be okay.
And so the next question we have, again, this is a reiteration of social distancing.
Yeah.
Could you just talk about that concept one more time,
Yes.
social distancing?
And that's what we're doing with these mitigations, City A and City B. The mitigation, that is the community mitigation, is preventing and promulgating social distancing. We're saying it's best for people to stay a decent distance away from themselves, and this is the best way to do it.
Thank you for that.
Yeah.
We have an interesting question here. Should we still allow kids to play with neighbors outside? Can we have play dates with 1 or 2 friends?
That's a very good question. I think, again, it's communication between the parents. Outdoors is probably better than indoors for maintaining distance. Kids can get pretty close to each other sometimes and lick each other's toys and things. So I think we have to be careful with that. And it's a parent monitoring thing. There can be transmission. To say one thing about kids, children do very well with this. They do. They get sick, but most of them have mild disease. And what we've seen from the news in China, in South Korea, in almost everywhere, the number of cases that are below the age of 18 years old is probably about 2.4%. And I'm not talking about mortality here. Kids aren't dying of this. So children may actually be in a safer position. They can spread the disease, but this is a little bit unlike flu, because what we're finding, and not all the information is in yet, but there may be more spread to children from adults rather than the other way around. I still think it makes sense to close the schools because there are kids that could then spread it, and if they are spreading it to other kids, it could go the other way too.
Sure. Let's move on now to a couple of questions about hand sanitizers. Are all hand sanitizers equal?
No, because if we're going to include things, the hand sanitizers have to have 60% or more alcohol in them. So if they don't, they're not going to work. Soap and water works great. I think that works probably better than hand sanitizers, is washing your hands. Now, obviously you can't do that when you're out and about, but hand sanitizer has to have 60% alcohol in it. And if it doesn't, you can't rely on it. There are a lot of naturopathic things coming out. People saying, well, let's put, I've got this olive oil and thyme, and that should do it. It won't. Those things don't work. There's no evidence that they work. And all they will do is give you a false sense of security that you're protecting yourself. So I know that it's difficult to get hand sanitizing material out there. People will be trying to make this stuff at home. I think that's probably not something we should do on a wide basis. But if you do it, make sure that 60% alcohol.
Thank you.
Base.
And by the way, thank you for, you tend to answer my next question as well,
Aha.
which is great. It's a very good sign.
I can read them too.
Is there a difference between washing with soap and water and washing with hand sanitizer?
Yeah, soap and water is probably better. There are two reasons that there are certain, this virus, certainly hand sanitizer will kill, but there are certain bacteria and viruses where you really do need to hand wash. And one is C. diff in our hospital. We have to actually hand wash. Hand sanitizers don't work. They do work for coronavirus. So if you can hand wash, that's great. And you would do that. It's maybe a little bit better, but hand sanitizer at 60% is certainly good enough and what we should be doing.
Excellent. Next question, how should we decide about cancelling our spring break plans?
The issue of traveling, I think, is a big one because you're going to be in tight spaces unless maybe you're the only one traveling, which could happen. I heard Kennedy Airport is almost empty in New York City. So, but you're going to be on a plane. Now, I'm not saying the person at the front of the plane is going to infect you, but when you're on a plane, the people imagine 6 feet on either side of you. That's 2 chairs to your right, 2 chairs to your left, 2 chairs in front, and 2 chairs in back, and that's a lot of people in that space. So it increases your risk. I don't think it's a good idea to be traveling, even domestically. The CDC is not saying that. But I get a lot of, you can imagine, I get a lot of my friends and colleagues asking me those questions. It probably is safe. I think for young people, are they going to do fine? Yes, but let's look at this here again, right? If you're going out there and you get sick and you're fine, but then you get somebody else sick and then they get their grandmother sick, that person dies. So I think for everybody's sake, the best thing to do is not to travel a lot. Car travel to a city, maybe, but airplane travel, long distance travel, right now, let's wait, let's watch, yeah.
And you've been looking at my questions again because
Yeah.
the next question is, what precautions should be made if you are flying for work? So if you have to work,
Yeah, if you have to, yeah. If you have to, I think the best thing to do, again, protect yourself, right? And there are 2 main things. Watch for the people around you. Again, if the person next to you is coughing and you have a mask, give it to them. Don't wear it yourself because that's what's going to protect you more. If the hand washing the surfaces, so you wash all the hard surfaces. Obviously, the fabric surfaces you can't wash, but anything that's a hard surface, bring wipes. Wash those areas off because somebody's probably touched that. If you do those 2 things, I think you're protecting yourself pretty well in those situations if you have to go.
Let's talk about surfaces. How long does it live on surfaces?
Yeah.
What do we know about how long this virus lives on different surfaces like plastic or fabric?
Fabric it's probably difficult to get it from a fabric, although we do know that these types of viruses, if we wear them on our masks and it gets on the mask, we could get it on our hands too, in the immediate setting. It can live on surfaces. You'll see things out there that vary widely, that this can live for days. And the real question, and we don't know everything about this, is can it live for days? And then can you put coronavirus here today, and then I come back to interview in a week, or somebody else comes in a week, touches that, I had coronavirus, will they get it? We don't know that. The coronavirus could be there, but it might not be an active virus. So some of the way that they do testing of these is just starting to come out, so we should be getting more data on that. I think you have to be careful with surfaces. Most surfaces could have been touched very recently, so I think that in that way, probably they need to be wiped down. And with surfaces, you need a little higher alcohol content, or the Clorox bleach wipes are the things that can also be used on those surfaces. People have said that, I've seen if you look at the World Health Organization, CDC cites, 1/3 a cup of Clorox bleach in a gallon of water is an adequate cleaning solution. You wouldn't want to put it all over yourself, but for surfaces, it would probably be good.
Thank you for that. The next question is a trio of questions about appointments, about healthcare appointments. First one, is it safe to go to appointments at a hospital that has a coronavirus patient?
Yes, it is. If you have to go, we are working very hard to keep all our clinics safe, to keep the hospital safe. And so the answer is yes. If you have to go to the hospital, if you have to go to a clinic, if you have to see your primary doctor, there are all kinds of protections in place. You will see those when you walk in. There will be mask stations, hand hygiene stations, and you should use those. And furthermore, we will actively be looking for ill patients so that they will be separated from patients who are not ill. So very important that people know that. We do want to say, though, if you don't need to go to the doctor, if you just have a cold, if you have cold symptoms and you think you have coronavirus, don't go in right now. It's even if you think you have coronavirus, it seems like a terrible thing to say, but if you have mild symptoms, if you're not immune compromised, if you're young, under the age of 70, going in will only put other people at risk. You're very likely, you are 80% or more chance of doing just fine on your own at home. And so avoiding that or calling your doctor to ask questions is the way to go. Because again, we want to protect people. There aren't treatments you're going to get for coronavirus. Right now, if you go in, nobody's going to test you for coronavirus yet. We don't have enough testing to be able to test anybody who wants to be tested. This was somebody said it on live television that anybody could get the test they wanted to. It's not true. We don't have that capability yet. We are testing the people who are the highest risk only, and we're working with public health to do that right now. In the coming weeks to months, we will have testing. We will be able to do that, and it might be reasonable to find and go to your doctor at that point. I know that's a statement that people don't want to hear, but it's an important one to know, because you're likely, if you have symptoms and you haven't had an obvious exposure and you go to your doctor, that you're not going to get tested for coronavirus unless you're in a risk group.
Sure. And then moving on, perfectly moving on, who are the people at highest risk who could get tested?
Yes, so if you're in a risk category, including the questions that came in about immune diseases, if you're on high dose immune modulators like prednisone or some of the other medications that are used, tacrolimus for people who have transplants, heart disease, patients with diabetes, if they're quite ill, should consider seeing their doctor. So there are risk factors out there. We're learning daily what those are, but it seems to be that you have to have one of these risk factors in order to do poorly with coronavirus.
Fantastic. The next question, is it possible to be infected with both influenza and COVID-19? If people are screening positive for influenza, should they still be screened additionally for COVID-19?
That's an excellent question that I don't know the answer to. The short answer is it possible to be infected by both? Yes, it's not impossible. One virus doesn't keep another virus out of your body. But generally, the people who have influenza, even in these other countries that have much more experience with COVID-19 than we do, it's mostly either flu or COVID-19. And as a matter of fact, when we screen patients, if they screen positive for flu and have symptoms that are consistent, we will assume that it's flu and treat them for flu. Okay. But that still means, right, because we have a lot of people who aren't vaccinated, and it's very likely that we'll have more flu deaths, even with the current coronavirus situation, than we have deaths from coronavirus. So you still want to protect people, so you still want to protect others around you if you have influenza.
Thank you for that. The next question that we have coming in, how can we support people with disabilities and chronic illness? Where can we find good information for planning in advance for them, and what do we need to do?
It's a great question. You do want to protect the elderly, those who can't care for themselves. The nursing home, it was very unfortunate in Washington that this hit a nursing facility with pretty high mortality rate. This is what we do to prevent it from spreading so that those people don't get infected. So again, the chain of events could be young people does okay, young person does okay, spreads to 3 young people who do okay. Finally, it gets to that poor person who can't manage the disease and dies. I think these people there's much more social distancing that should occur. I think people over the age of 70 who are chronically ill should probably not be going out into crowded spaces at all. They should avoid that, at least for the moment. I think we have to see how this is going here at the moment. That's the way to protect them, to make sure that they have ability to clean their hands, to avoid touching things. If they have to go to the doctor, call ahead of time to make sure that the clinic has a procedure for people who are sick versus not sick. Those things are important.
Thank you. Next question, how do I get my employer to take this seriously? Should I insist on working from home? It's a tricky one.
I would say there are some employers who are taking the tack that this is not a big deal, and it is. And I think if you are somebody, the problem is I don't want to tell you what to do because I don't want you to get fired, but the workers that can work from home should be working from home. I have 2 sons who work for companies that are handling this very well and have everybody that can work remotely is working remotely in those companies, and that's a mandate. It's not whether or not, it's not yes, maybe. It's a mandate, and so I think you do have to push your employer to do that. Yes. Don't lose your job over it, and protect yourself if you have to go to work. But I think particularly in cities where you're commuting on mass transit, you have to figure that out. Yeah.
Thank you for that. Can we reiterate our whiteboard point about flattening the curve? Can you go over what it means to flatten the curve? I think this is a crucial point and it bears repeating.
Yes. Flattening the curve, so what it means is decreasing the number of people who are getting disease at any one time. So you may have, let's say both of these curves, if that whole area inside here, maybe this is all, you probably have more people in this curve here than you do in this curve here, and you want to spread out how long, even if these two were the same, if this was 100,000 people and this was 100,000 people, you want to smooth that out over time, and that means these mitigation factors, what they do is they prevent people from being in contact, they decrease the rate of spread, they decrease, they might increase the time in which this virus is causing problems, but over time it's manageable. So what you'll end up seeing is that the hospitals they'll be close to full, but they'll be hanging in there. In this situation, which may be happening in some countries right now, the hospitals are bursting from the seams. So it's really decreasing the contacts that occur to prevent our sickest people from getting this disease. If you think about what I was talking about, which is young people, right? They're not going to get so sick, and they're going to be out there and they're going to want to play and do things and go to class and work. But the points at which they get infection, which will then spread to older folks. If you take that away, here are our older folks here. These are the people who are likely to get sick. Here's everybody around them that's not going to get as sick. If you do nothing, this goes to here, 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 goes to here. If you these young people are staying home and not getting sick, you're protecting you're protecting. It's called herd. It's not herd immunity because we don't have immunity yet, but you're protecting your older folks from getting this disease. You're protecting your sick folks, patients with hypertension, patients with heart disease. You're forming a barrier around them. Let's think about this as let's get around our folks and protect them. Not too close to them, but let's protect them by following this mitigation, not being so critical of every city that says, hey, we got to, shut down the subway for the moment. I don't know if that's going to happen in New York City, but if it does, we should try it because this is an unusual situation. We've never been in this. 1918 was the last time this occurred. The first SARS didn't get to this point because it didn't spread like this one. So I think that's why we have to do it.
Thank you. Thank you. Next question for us. I am over 60 and volunteer in a hospital. Should I stop going to the hospital to help? Who qualifies as older and more at risk?
So meaning in the guidelines, it would say people greater than 70.
Okay.
Is that a cutoff? There have been, somebody will say, hey, but there have been deaths. If you look at the average age of death in some of these countries, it's actually maybe even in the 50s. So I think we have to be, older people who are healthy are likely to do very well. People over 80, just to give you an idea, people over 80 have a very high mortality rate in the maybe 20% range with this disease. And so the older you are, the more difficult this is. But if you are 50, 60, I'm over 50, if you're healthy, you're likely to do very well with this also.
Thank you, thank you. Let's move back. You touched on this earlier. Why is it not really affecting kids?
I don't know. It's not that it's not affecting them, it's just that they have mild disease.
Okay.
The virus has to get down into the lungs to cause pneumonia. We can find it up in the mucosa, in the nose, in the mouth, in the throat of children. To cause damage, it has to get down low in the lungs. It may be that they have a better immune barrier to prevent that spread. It's not completely clear. As a matter of fact, if you look at the 1918 influenza, the people that did worse were the younger people. So it was even more concerning because parents were concerned about their kids. And young people who were healthy, their immune system would do them in. That doesn't seem to be the case here. So people's immune systems are probably, their healthy young immune systems are probably protecting them.
Thank you. The next question, another interesting one. Should grandparents who babysit small children, especially ones with siblings in school, stop babysitting?
I think if they really have to monitor kids, and if there's sniffles, if there's anything that indicates they're sick, they should not be taken care of by grandparents, by people who are older. I know that's a difficult thing, but again, this is a very mild disease in young kids, and kids are likely to present, it will look nothing more like than the cold symptoms, which is what normal coronaviruses are like. So I do think we have to be very careful with that. And again, you can protect. It's hard to get a kid to wear a mask. So I don't think you're going to be able to get a kid to wear a mask just so that they can be with their grandparents. So,
Indeed, I don't think I could get any of mine.
Yeah.
So what do you believe effects will be on someone with cystic fibrosis?
I have not seen any data on cystic fibrosis, but it is a lung disease where you're susceptible. I think people with cystic fibrosis are susceptible. And the reason I think the question comes up is because those people are typically young. Cystic fibrosis patients are children, are people under the age of 40. I think this would be a risk. At least I would assume that it is at this point until we get more data. What's interesting, to give you a point about data, what we found is that women who are pregnant do quite well actually with this disease, which was not the case with influenza. So data comes out rather slowly. A lot of the data from China in the beginning, it was coming in so quickly, and we weren't sure that all of it was correct. And so now we're going to be getting more studies from all over the world, including China, to help us make decisions.
Thank you for that. The next question from someone with major medical issues: should I self-isolate to the point of restricting my children from coming into my house? One's a teacher, one's traveling domestically.
Answer to that, again, I would think you can see your children. I think be careful with hugging, especially if they're, I think make sure that if they're, I assume these are adult children, that they, that they're monitoring their symptoms. You don't have to isolate yourself in a room when your children are there. You can be in the same room with your children. You can have meals with those children. Maintaining a distance at this point, social distancing, is probably a good idea. And especially if they're sick, they should not be around you or wear a mask. I think those would be the things. Again, I'm going back to one theme, but it's the theme I think that works. And it works in the healthcare setting. We know that because we're able to protect ourselves from this disease. So out in the community, again, hand hygiene to prevent the spread from surfaces and fomites and the act of touching your face, and then distance from people, especially people who are sick.
Thank you. So we are about 3/4 of the way through here. We've got a lot more questions that we're going to try and answer. Next question, what about places like the zoo? Are outdoor places okay for now?
I think so. They can get pretty crowded. I don't know, and I think what's going to happen is cities are going to make those decisions. The zoo may close. The places are closing even on University of Michigan campus. You can't go play tennis at the Varsity Tennis Center because they're closing. So I think outdoor settings are safer. And you bring up animals here. There's been some cases of dogs getting this, so you're probably not going to get it from the tiger cage. You're probably not going to get it from other animals. Outdoor things are probably okay.
Sure.
Yeah.
Sure. Do you believe this will die down in summer?
Good question. And the implication is that viruses don't do as well. Caveats here. We don't have enough data on this virus, obviously, because we haven't gone through a year with this virus. Coronaviruses in general, there is some seasonality to those viruses. What we have to consider, though, is a virus that's new in a community that has no immunity, where the virus can kind of spread rampantly. So there may be a dip, but I would expect that it's going to be around at some level, and we would expect surges again in the fall if it did go down. So I think we have to be vigilant in that way, continue what we're doing. People will ask, how long do we do these things? The mitigation, the community mitigation. I don't know that I have an answer to that. It's China's still doing it 50 days later, but they're having some success with decrease in cases. I think we're going to be doing it for a while.
Are there any antivirals that can be used for treatment?
There's no approved antivirals. There's a drug called remdesivir that is being studied right now, a drug by a company called Gilead. But there's very little ability to get it. We have to go to the company and ask them, and they are running out of product. They're giving it to the sickest patients. There's you can't be too sick to get it, because if your mortality rate's going to be very high, they say we're not going to give it to somebody like that. And if you're too well and young, you're not going to get it because you don't need it. So there's a sweet spot in there, but they're using it in China. It's being used up very quickly. There are some other medications that are being looked at, but there's no approved medication. Don't think you're going to go to your doctor and get a medication to treat this. That's not going to happen. We may try some things within the hospital there isn't good evidence for at this point. We would never do anything to put patients at risk by giving them something that might hurt them. But if it doesn't seem like it'll hurt, and there's anecdotal means there's a case here or a case there, we may use some medications. But Tamiflu doesn't work. It's a drug that's out there for influenza.
Sure.
Other antivirals haven't been very successful. We have some HIV drugs that they've tried that have shown some promise, but it's not very clear that they work They've shown some promise in the first SARS virus. we don't know about how well it's going to work here. So these are things we're looking into. But again, as I say, don't expect to, you have symptoms of a cold, you're going to go to the hospital and ask for something like this and get it. It's not there.
Thank you for that. Next question is an interesting one. What about service workers? What can they do to protect themselves if they have to go to work and can't work from home?
Yeah, that's a great question. I think that's, there are a lot of service workers out there. I think workplaces are going to be a lot less crowded, so I think it'll be safer for those people. In our hospital, our service workers we're using the same protections that we do when they're going into rooms to clean up after people who have had COVID, when we start to get more of those cases. Hand washing is a big one. Again, in this situation, wearing gloves when you're working on surfaces is probably a good thing to do. And the standard thing, protect from getting it from your hands and protect yourself from getting it from somebody who's coughing. One thing to be clear about, this isn't hovering in the air when you walk through a building. It's not as if you're going to walk through a cloud of coronavirus and get it. There has to be a connection. This is what we call a droplet spread organism. Somebody coughs, it goes 3 to 6 feet and then falls to the ground. It doesn't hover in the air. Hovering in the air is something like tuberculosis or measles. Those we have. There are different ways to mitigate those diseases, which are much more difficult. But this one, very clear how you can protect yourself.
Thank you. And the next question, how reliable are the current COVID-19 tests? False positive, false negative?
That's another good question. And you're getting right to the cutting edge of science here. They're pretty good. The sensitivity, how good the negatives and the positives are probably there. We don't know all the data yet, and I don't want to quote anything. Probably the positive test is very good.
Sure.
I don't know that we're seeing many false positives. There may be false negatives, and the reason somebody may have a false negative is maybe they don't have it as much in their upper nose as they do in their lung if they have pneumonia. And what's happened in certain situations is that when we get deeper specimens, we eventually find it. But typically, if somebody has cold symptoms, it should be a very good test to rule it out.
Thank you.
Also.
And the next question we have up, we're putting you all over the map here. Yeah. What about grocery shopping, especially fresh produce? How can I clean them? Can this COVID-19 be spread through food?
Yeah, that's a good question. I'm not that it is spread through food. I think you're saying if somebody with COVID comes by and looks and says, I don't want this orange, and puts it back,
sure.
And then you come by and grab that orange 5 minutes later, are you going to get COVID-19? Theoretically, that's possible. I don't know that washing fruit, but peeling fruit is probably a good idea. Washing the way you would normally wash grapes and strawberries and things like that. I don't think that has to be, I don't think that's an efficient way that this virus spreads.
Thank you.
Yeah.
Are there things I can do to boost my immune system to protect myself? Fresh fruit, vitamin C, sleep?
I like all those. Yes.
Me too.
Can you protect yourself? Does this protect you? Being as healthy as possible if you were to get infected with this virus. So all of those things keep you healthy. Sleep, definitely. I think that's a problem for people these days. But yes, doing those things is healthy and will help with staying healthy.
Sure. Next question we have up, is it okay to go outdoors in nature areas for those that might be symptomatic?
Symptomatic and have the virus. I don't know if I'm understanding. If you're sick and you're not that sick and you go out on the nature hike, I think that's fine. You just have to. I think you want to be careful. And if you're in contact with anybody, if you're going in a place where you're going to see very few people and you're going to maintain 6 feet of distance, that's okay. If you're going to be in a place where there are a lot of people, where you're going to be passing people you know that you'll stop and talk to, you should wear a mask. I think anybody that leaves the house with illness should probably have a mask and should be wearing it when they're around other people.
Great. Great. Next question about snowbirds. Should older adults return to Michigan, and if so, is it safe for them to fly?
Yeah, and I think, again, if you're able to stay somewhere, I had a patient who was in Florida and wanted to know that exact question. And the answer to that is if you can stay pat, stay. I think if you can stay in a place and you have the resources to remain there, I think that it's probably best not to do a lot of traveling right now. Florida has cases, Michigan has cases. If you're going to be traveling on an airplane, it does increase the risk as an older person. And although if you have to get home, then you have to do it. And if flights are going, that's okay. And again, protecting yourself when you do it is hand washing, washing the surfaces that you can on an airplane, near your seat, and staying away from people who are sick is probably good. Remember, again, when you walk into a plane, it's not as if just being in an area is going to transmit coronavirus. There has to be a transmission, a mode of transmission, which is either somebody coughing within 6 feet or from a surface.
So we are running a bit low on time. Let's try and squeeze in 2 or 3 more questions if we can. If we are relatively healthy and low risk, how should we help people in our community? Should we grocery shop for them or watch their children?
I like that. Yes, you should help them out. I think doing some grocery shopping for them is a great idea. If you have a neighbor who's disabled or who really doesn't want to go out, I think that is nice, and I would say you should do that. Being careful yourself when you go out, being careful not to get sick so that you then transmit it to that person, but being a good neighbor is an outstanding thing to do, and I'm glad people are asking about that. What was the other part of that question?
Can we grocery shop for them? Can we watch their children?
Yeah, I think so. I think you can do all of those things. If you're a healthy adult, to be the one helping. Again, because of the mitigation, though, there are a lot of people that think, well, I'll just get this disease and then I'll be done with it. But realize that you getting it could lead to a transmission cascade that then leads to somebody who's more vulnerable. So don't feel like, oh, I'm young, I can get this. Still protect yourself from it, because if you're really being a good citizen, you're worried about down the line transmission from something you might do.
Great. Probably room for one more question. Why are there so many different answers about how fatal COVID-19 is?
That's a good question, and this is producing a lot of anxiety, because if you look at Italy, the mortality rates are very high, although if you look at South Korea, the mortality rates are exceedingly low, about 0.7%. On average, the mortality rate seems to be in the anywhere from 1% to 3% range in some of these countries. You have to take all of these with a grain of salt, because particularly in China, what we saw, if you take and look at the numbers in China and take the number of deaths divided by the total number, it'll probably be about 3.4%. But one thing that was very clear is we weren't picking up in China the cases that were very asymptomatic. So that bottom number, which is called the denominator, of all the cases, could be a lot higher. You're likely to find the people who are the sickest and dying, of course. You're not likely to find the people who are asymptomatic. So we really have to look at these data. It's hard not to be scared when you hear higher mortality rates. But as far as we know, this virus, coronaviruses, they change a little bit, and so we can footprint them, but they don't change so much that we should be seeing vast changes in the way it's acting. So that's a good question, but be careful about the things you read. In any publication, look at the CDC sites, look at the World Health Organization sites. Those are tried and true, and they're not hiding anything. We're not trying to hide anything about mortality, morbidity. But I think we can sometimes scare ourselves by reading too much.
Yeah. So as we wind down on this, do you have any final thoughts? If somebody was tuning in now, what would you like them to take away from this?
Well, what I would like them to take, again, I think this these two situations that are causing concern are the one where we're saying the virus is not so bad, yet we're doing all these really drastic mitigation. We're doing all this stuff on mitigation. It's because we're trying to decrease and flatten the curve. We want to make sure that, particularly within the healthcare setting, that we can manage the patients coming in. We'd rather get a lot of patients coming in over a long period of time that we can manage versus everybody coming in at once, where we really are going to have a hard time managing it and will lead to a lot more mortality. So understand that the cities, the states that are doing these mitigation tactics, that they are, we in public health think that it is, and within the health system, think that this is absolutely necessary, that it's not overkill. Even though somebody says, well, we just have 2 cases in Michigan, why are we closing the schools? We're closing the schools because there's likely more. We'll have more testing available. We'll be able to test people. When we can start testing people and we know exactly who's sick, maybe we can back off on some of these mitigation tactics and say, okay, we're just going to try and isolate the people who have this disease.
Thank you. Thank you so much for your expertise today. Thank you for participating in this discussion. We know this is an area that's changing daily. It's great to have your input on this. For all of our Michigan Medicine COVID-19 updates, you can visit uofmhealth.org/coronavirus. We'll be posting this link if we haven't done so already in our comments section. Once more, thank you to our expert, Dr. Cinti.
Thanks for doing this.
To our viewers. We're going to close now with our Michigan Medicine hand washing video.
Okay, well, here we'll do a little here.
Participate.
Wait a minute. There you go. All around, between the fingers. Take a look at that video. It'll tell you exactly how to do it.
Want to cut your chance of getting sick or making other people sick? Clean your hands. It only takes 20 seconds to do it right, getting all the surfaces of your hands clean. How long is 20 seconds? The University of Michigan fight song can help you remember. Don't forget to let it all evaporate before touching anything or anyone else. Now, soap and water. And it doesn't have to be hot water. Cold or warm is fine, and it doesn't dry your skin out as much. If you can see dirt or grime on your hands, or you just use the toilet, use soap and water if you possibly can. Otherwise, alcohol-based cleaners are just as good. Of course, you can use another song to remember the right amount of time to clean your hands, but we like this one.